Hello, everyone. My name is Lexia Nelson, and today I will be going over my week 7 ISP for our NCLEX prep. And this is going to be my remediation for our weekly assignments. So for my overall performance, so for Kaplan, out of the 5 quizzes that I took for the week, I got a 67 average. For the pass point exam 1 that we took, I got a 65.33. And for UWorld, I got an 83 on the quiz. So for the total amount of questions for all 3 resources, I did 322 this week. And the average for all the resources is, let me calculate that really quick. My apologies for forgetting to put that on there. It was a 72% for all 3 resources for all the averages combined. So first Kaplan. So for Kaplan, now on this week, I know that we had to get a 60 or above. So I met the criteria on all the quizzes except for quiz number 2. I got a 56. So to make up for those extra points lost, I did a 10 question remediation and I got a 73% on the remediation for that. But for the other quizzes, I got a 74 on quiz 1. Quiz 3 was a 67. Quiz 4 was a 75 and quiz 5 was a 63. So my quiz average for the week was a 67, and that is not including the 10 question remediation for quiz number 2. So for UWorld, we did our next gen quiz on there. It covered cardiac mainly. So I got a 83%. There was 36 questions, and then I completed all 14 UWorld videos and the associated notes, and I turned those in. Now for pass point, I took the 150 question practice exam, number 1, and I got a 65.33, and that was out of 100 points total. So for the top 3 missed questions, so I have Kaplan here. So it talks about indwelling urinary catheter. And the reason why I picked this question is because it was something I generally did not really know or remember from nursing school, but it's also something that I've been noticing a lot. So when we have to get a urinalysis from a patient with an indwelling catheter, instead of detaching the tubing from the drainage bag, because that's what I used to think you would do, because if you're getting it from the drainage bag itself, it might not be sterile. So I was like, okay, let's disconnect it. But that's at a risk for infection because you're breaking that integrity. You're exposing that by doing so. So you would aspirate the urine from the drainage tubing port, and then you would do this by keeping the system sterile. And then so the specimen would be obtained by sterile technique. Now for my second Kaplan question, this one has to do with the math. The reason why I wanted to just put this one was because I had to recall after seeing this that we never round up on pediatric dose calculations, which I did not realize. Because I know it's different kind of everywhere you go, but I guess it just depends. But I know, and the same thing with when you calculate kgs, you have to consider the rounding for pediatrics as well. So my third one from Kaplan, I'm so used to when it talks about the 6-second EKG strips, I know that you multiply that by 10, but I wasn't really sure on this one. So for this one, it shows that we should count the number of boxes between the peaks of the 2 QRS complexes, then divide by 1500 by that number, which it was something I did not know we were supposed to do, as I'm so used to the 6-second EKG strips. But I calculated it afterwards and I got the 79 like it shows, but I originally put 60. And then I wanted to put this fourth question just because for this one, it talks about getting TPN, and I was kind of second guessing. Oh, wait, I did put it. My bad. What I meant to say was I almost second guessed because I was like, okay, tingling and numbness, that doesn't sound like it's really that related to TPN, but I know that's hypocalcemia, which is very, very important. So I did not recognize when doing this question that it was refeeding syndrome, but I did realize that it was those are symptoms of hypocalcemia or some other type of electrolyte imbalance as a result. So those are my missed questions. And then now I would like to go over my areas of and for improvement. So for areas of improvement, I have been not selecting an answer choice on a SATA question if I questioned that answer choice. I have seen that cause my scores to go really, really high because I have been like, okay, if I have a select all that apply and there's an answer choice and I'm like, I don't know if I've ever heard of that with this condition before, or if I'm like, I'm just not 100% sure, I won't put it. And that has been helping me tremendously. Now, areas for improvement, if it talks about unexpected findings, do not include expected findings in your answer choices. So for example, for TB, if it were to say something like what's an unexpected finding or what's something that the nurse does not expect, we would not put night sweats and fever because that is expected in TB. So I am getting better at this, but I need to try not to overthink and confuse myself with that. I need to be able to differentiate well expected versus unexpected findings or findings that alert something in us as a nurse that we should make priority. And then lastly, when doing next gen quiz questions, make sure to double check if it is the same scenario or not, because sometimes I'll think it's the same scenario because sometimes those next gen questions will have the same scenario for 4 to 6 questions. It just depends, but I need to double check and make sure it's the same scenario, even though I might not have to read it over again because I have it fresh on my mind. It probably is best to go back and just scan through and make sure, but I need to for sure make sure that if it's the same scenario or not. I recently applied the question scenario before to the next question. That happened to me. I can't remember if it was Kaplan or UWorld, but I applied my answer choice my answer choices were based on a different scenario from a previous question. And that includes everything from this week.